Perfect.
All right. Welcome, everybody. Welcome to those who are here on Zoom. Welcome to those who are in the classroom. I am happy to have you all here. For those I don't know, I am Diane Bales. I am the Child Life Program Director at UGA. And today's purpose is for you to hear from Kym Allen, those of you in the classroom and those of you on Zoom, about the Joint Child Life Program. And so she's going to go through some slides and then she's going to answer questions. I'm going to mute myself because you don't need to hear me right now. Kym, do you want me to hold questions to the end? If I get any of them coming in on chat?
No, we can just, I'm good with being interrupted.
Okay, sounds good. If anybody who is on Zoom wants to ask a question, you can either chat it or raise your hand so that you can indicate to me that you want to ask a question, and I will let you know if any come up, Kym, and obviously you can handle questions that are in the classroom.
Yes, fabulous.
Awesome. Welcome. Thank you for being here.
All right, no worries. Thank you for having me. And we're just going to chat today about our internship program. So this is to give you a little bit of information if you're interested in coming to Augusta for our program, which is a year-long program. Look at that. Oh, if that's all I have to do, I could probably do that. Okay, I'm good. I got that.
Cool.
Woohoo! Okay, so let's chat about how do you become a child life specialist, right? First, you have to earn a bachelor's degree, right? You have to take 10 college level courses in child life or a related subject. Now, ACLP is a great website to look at, to learn, to love, to navigate around. Make sure that you have 10 courses that will fit into their little scheme of where you need to have classes. You have to complete a 480-hour internship, and actually I think that this is now a 520-hour internship, headed towards the 600 hours.
I think it's actually 600 now, Kym.
It is now?
I think so.
I never really pay attention to that because our girls get like 1,300 hours. So that doesn't really do much for me. You have to complete a course taught by a certified child life specialist, right? And then you also have to sit for and pass the certification exam. A traditional internship, and these are, offered at all different places. Now I will say, and let me just talk about COVID for just a second. I'll probably bring it up a couple times, but lots of programs have made some serious adjustments because of COVID. I was just on an internship coordinator discussion on Friday with internship coordinators from all over the country. There were several of them that have suspended internships until next fall. There are several that have suspended other programs. They had to stop their spring, and they're bringing the spring people back. So COVID has really changed a lot as far as child life staffing. Several programs have faced furloughs. Several programs have faced program cuts. The difference between a furlough and a cut: furlough means that hopefully you're coming back, right, in your same capacity back to working as a child life specialist. Cuts are that they have permanently cut the program or permanently cut positions or have suspended operations in the child life area. Several programs have faced that. So I think that in the effort to be transparent, that's important for all of you to understand and for all of you to see that, what I would have said last year at this time and this year is a little bit different as far as other programs around the country. Now, I can speak to my program to say that we have not lost any staffing positions, right? Nor do we anticipate that we will, but I don't know what it's going to look like 6 months down the road. I did just hire somebody, so there's that. And anybody in the field knows that when you're able to, get a position, have a position that's vacated and get it cleared to hire, that's a pretty optimistic view of what what your department's future is going to be like. So there's that. Traditional internship usually lasts 15 or 16 weeks, and that's usually one school semester. You usually get your clinical experience in one or two different areas, right? So you might go to surgery, and then you might go to outpatient allergy, right? You might not see all the areas of the hospital. And I'm also going to put the 3 girls who did their internship mostly because of COVID. We had a little hiccup at the end, but I'm going to put them on the spot in a little bit, and they're going to talk about their experiences and the fact of that they got to see all areas that Child Life was in, for the most part, until we had to literally ship them out because of COVID. But I also will tell you that our students are back. We started seeing med students and nursing students. And when, of course, they came back, I was jumping up and down saying, well, we're bringing Child Life students back too. So we're a teaching institution. That's part of our mission. And if we're going to bring other allied health professionals back in, well, Child Life is part of that conglomeration, and they're going to be back with us. So our AU-UGA internship is a full academic year, and it goes, the students begin in August and they stay through May. They will get 5 or 6 different unique rotations. This is mainly based on my staffing. ACLP has said that you can only supervise a student if you have so many professional hours, right? So with changing of staff, sometimes I can't put somebody with a staff person because they don't have enough hours. Luckily, the person that I just hired, I recruited from another hospital, and she has hours that she came to us with. So she'll be supervising a student much quicker than some of my new hires who are fresh grads. They have at least 1,248 hours. This is double what other internships usually provide, and most interns graduate with more hours, unless of course there's a pandemic. You see all areas of the hospital where Child Life is present. So even if I have someone, my new recruit, my staff person, is working in sedation, and I stole her from another program where she was working in sedation. So even though she can't supervise a student, we will still shuttle our current students through her so they can see that process. Now, she won't be their direct supervisor, but they'll get that opportunity to see how Child Life functions as part of the sedation team. We have 100% pass rate for the Child Life examination. Let me say that again, because it's something I'm very proud of, and I'm looking at the 3 girls who are about to take the test at some point, and looking at them going, don't change this number. We have 100% pass rate, right? Every single one of the students from this program have passed the Child Life certification exam. That is something that I am uber proud of. That is a very hard statistic to keep up with, right? But I think that between UGA giving the academic background and then coming to us at the Children's Hospital of Georgia, and you get the clinical background, that combination has obviously proven to be very successful, right? What is Augusta like? I'll tell you, it's not Athens, right? Although, you know, I was just talking to the people in the room about, this is a ghost town. Like, this is the craziest thing I have ever seen. I just went down Lumpkin at almost lunch, and I could have counted on one hand how many people I saw. It was a little bit sad to me. But, you know, let's look into the future and better days ahead, and, you know, the whole 9 yards. In our numbers, I know in Athens, numbers are a little bit up and down. But I will tell you, in Augusta, in our region, our numbers are down substantially. Again, knock on wood. What is Augusta like? It is not Athens, but there's still lots of fun things to do. If you are interested in going out every evening, then this is not the program for you, right? If you're interested in bar hopping every night, then this is not the program for you, because you might be at the hospital until midnight. right? Working in the ER, or you might have to be at the hospital at 6 in the morning to prepare kids for surgery. I often tell people that this is like going to school full time and also working, right? So you're working at the hospital and you're still going to school. You still have assignments, you still have readings, you still have projects, but you're also doing clinical work with patients and families in the hospital. In the bonuses, there's great cake at the Boll Weevil. There's beautiful scenery, I guess, at the canal, and there are fun holiday lights at the Lights of the South. All right, there's that. The Children's Hospital of Georgia is where all of the clinical experiences are done. What you will learn, we obviously want to teach all of the clinical competencies of a child life specialist. So that includes coping and distraction, preparation, medical play. You get to rotate with me, and I am the administrator, so I get to do all that fun budget, administrative, evaluation kind of stuff. So you learn a little bit about that. Pain management, family support, and normalization. What will you learn? You'll learn also in-depth child development. You will come into contact with people who are not culturally the same as you. You'll learn common diagnosis and procedures. You'll learn assessment. You will learn flexibility. That's my favorite word. You hear it once, you hear it a million times during the internship. Flexibility is key and very important, especially in the field of child life. And you will learn about death and dying, right? We do it through a class. You'll also actually see it, come into contact with it. Learn what we do with grief interventions with patients and families. Not the funnest part of our job, but still necessary, and also definitely a gift that we can be with these families during what is really their worst day ever, right? What's administration? You learn behind the scenes child life work, including budgeting, donations, special events, planning, and facilitating. You learn about monthly reports. You're actually responsible for monthly reports and statistics for developmental playgroups, which hopefully the girls will maybe hit on when they chat in a minute. Charting, so you guys didn't think that you were gonna get off scot-free, did you? You're all sitting there looking at me like, what? Yeah, you're gonna have to talk. Charting, and you will learn statistics tracking. We have these are some of our special events. This is life before pandemic. We had special events that came into the hospital, and yes, we entertained those. Kids got to see those. Let's see. What classes do you take when you're with me in Augusta? You take Student Seminar, which is a class that we have every week. It's usually a 1.5 to 2 hour lecture where we're talking about different aspects of child life. We go more in depth than what they do in a class that just maybe brushes on the topic, right? Plus, we're using some experiential learning because you're actually seeing it. So you just prepped a kid this morning, and then we're talking about preparation and seminar. So when the kids started running down the hall, what were the things that you tried to do, right? What were the things, how was that kid coping, that kind of thing. You take a medical ethics class that is not taught by me. Everything else is taught by Child Life. Medical terminology is kind of a self-study course. It's important because when you go to rounds or when you're reading in a patient chart, if you don't have that background, if you don't see a word and don't have like the context, at least you can say, oh, that has something to do, it's a NEF. It says something to do with the kidney. Okay, well, this kid is probably in renal failure or whatever. You can kind of figure it out. We do a death and dying seminar. We do life class, which traditionally, I'll explain what that looks like. Traditionally, students are paired up with a family who has a patient with long-term chronic diagnosis. That can be anything from cancer to cerebral palsy, to diabetes, to galactosemia, all different kinds of stuff. And then the students go and spend time with that family outside the walls of the hospital. Now, I say that, and I was just explaining to the 3 students who were there last year that life class is going to look a little different in a pandemic situation. So, but let's pretend like starting in 2021, when that calendar turns, that the pandemic goes by and we don't have to deal with that anymore. So live class would be, yeah, no kidding. Live class would be getting assigned a family and a patient and going out and seeing how they function outside in a normal, typical, natural environment, okay? We also do Cram for the Exam, which is a course to kind of, or just like a little seminar to kind of teach our students how previous people have studied for the exam and what they feel like is important. So that is what you take. Okay, so these are some pictures from live class where the student was paired with a family. They learn what day-to-day life is like. We talked about that. Benefits of a year-long internship. And for you guys, that is Stephanie, which is kind of funny, just for the record. So there are 5 to 6 different unique rotations, right? Experienced supervisors. The cool thing about all of my staff is that we all have our niche in the area that we work, right? We all have different supervisory styles. We all have different child life styles. So you get to see 6 different ways that people deliver child life therapeutic interventions to patients and families. You see the hospital in all different seasons. We were just talking also about our challenges of trying to figure out what we're going to do for trick or treat and for celebrating that. And I can't even think about Christmas right now, so we're just going to go one holiday at a time. And you leave our internship being fully prepared to take the certification exam, right? We want to give you all the knowledge base. We want to give you all of the clinical foundations that will make you a successful child life specialist. My goal is to prepare you to be a child life specialist anywhere. Now, I'll tell you, like, we don't have a NICU child life specialist, right? But I would think that these 3 girls who are sitting in front of me, I could push out and say, they've never really worked full-time in a NICU, but I'll tell you that they've all worked with babies. They all can assess development. They all work with families. They've all worked with teenagers that could be the baby's teen mom. They are equipped to work in any child life capacity that is possible. That's my goal, right? Even if they didn't experience it directly in our hospital, they have the skill set that they can pick pieces and parts with and go out and work with a burn population, or like I said, NICU, or a sedation position that they might have had just little pieces and parts of experience with. So you get lots of experience with kids and families, right? So these are some of the rotations: clinics, emergency room, general peds, hem-onc, surgery, and then of course like our float position with sedation and that kind of thing. Seasons and holidays, you're able to see through different seasons. Halloween, there's Thankful Festival. That'll all look a little different this year, but we're trucking along. Who is teaching you? These are all of our friends who are teaching you. And let me also talk about Nugget and Casey. So they're 2 very important, and we really need to get pictures of them and put in this slideshow. We have a facility dog program. So there are 2 staff members who are furry and have tails. So that is Nugget, who primarily sees kids in the clinic in the morning, and in the afternoon does inpatient referrals. And then Casey, who comes in and does surgery preps with kids in the morning, and then sees inpatient surgery patients in the afternoon. So we have integrated them as part of our Child Life Toolbox, and they have been amazing in working with kids and families and helping to reach our child life goals with patients. We are experienced supervisors who mentor, teach, and encourage. Well, let me see, actually 1, 2, We're talking 50% now have come from the AU-UGA program. So we've got that. You get to experience 5 to 6 different unique teaching styles. I also just want to throw out that in case you haven't investigated, internships are highly competitive. One of my best friends from grad school works in a hospital in the Northeast area. She was, when I spoke to her last week, reviewing 150 applications for 2 internship spots. 150 applications for 2 internship slots, okay? This is a major medical center that she works with up in the Northeast, right? They have over 30 child life specialists, and they have 2 internship slots for 30 child life specialists. So I think it's really important and very realistic to think about that. You know, you say, well, you know, I'm the president of my sorority, or going to be next year, and I don't want to leave for a year because, you know, there's going to be football, and football really was not so great this year. So football will be great next year, and I'll get student tickets and blah, 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 blah. So I think I'm just going to wait and then graduate and then go look for an internship. Well, and a lot of people do that successfully, but I'm saying, and especially since the pandemic, internships are increasingly more competitive because we have essentially canceled, lots of programs have canceled an entire 2 rotations for interns. So all those interns are still out looking for positions. So I would caution you to think about that and to seriously think about, is it important for me to be the president of my sorority and go to a football game, or is it important for me to think about my career and what I want to do when I grow up and be a grown-up? So yeah, and adulting kind of, you know, in case nobody told you, adulting kind of stinks every once in a while, but sometimes you have to make decisions that is in the best interest of where you see yourself in the future versus, you know, that Georgia Tech game that you really have to be at next year. So just putting it out there because, oh, by the way, that is one of the biggest questions. If you do come to Augusta, you're considered a transient student at Augusta University and you are not eligible for football tickets. So I'll just answer that straight up. All right. We already talked about 100% pass rate. Ladies, I'm looking at you. Yep. Cram for the exam during the 2nd semester, weekly student seminars to discuss relevant child life issues, daily, weekly preparation through clinical time, and weekly work. And maybe these ladies can talk a little bit about the weekly work and big fat notebook and all that kind of fun stuff. Group assignments, you must work well in a team setting. There are a lot of things that you do as a team, right? And so I think that that's important because when you're in healthcare, you are a team. You're working with a nursing team, you're working with a medical team. You are not just working in your own little silo as I'm the child life specialist and I'm gonna run here and do this and run here and do that. You are working in a very interdisciplinary team. So we try to give you that experience before you have to worry about that, right? And you know, there's the good, bad, and the ugly of working as a team, right? You got to figure it out. You got to have good communication. You have to have good teamwork. You have to have collaboration. You have to have, you know, the push and the pull of working in a team. Who's going to be the leader? Does that same person have to be the leader the entire time? And maybe our friends can talk about that too. Developmental playgroups is a task that student interns take full ownership of, right? So we are the developmental experts when we walk into the room. So we plan activities for infants, toddlers, preschoolers, school age, and adolescents. There has to be a developmental task that they're working on. Say with infants, you're working on reaching and grasping. Then the interns will plan an activity that works on that, and they will go see every infant in the hospital on Tuesday morning to do infant developmental playgroup. They will assess whether they've met the developmental goal of reaching and grasping, right? And then they will work with the family. They will educate the family. This is what we're doing. This is why we're doing it. So that is something that they keep statistics with. They coordinate that. They're given a budget. They go shopping for it. So it's their own little task, and it's their own special event, I guess you could call it, that they do on a weekly basis. It also helps them establish rapport with kids. It helps them meet the chronic population, because they might see kids for a couple developmental playgroup weeks, right? Because they've been in the hospital for 3 weeks. Medical Play Mondays, that is a kind of another piece of doing therapeutic child life interventions. That starts in January, and so they have 16 weeks of planning and implementing medical play and working with kids. Some that is goal oriented, some that is just general familiarization with medical equipment, right? And helping kids understand. Let's see. All right, syringe sculptures. These are just some examples. All right, healthy grandparenting is now kind of on hiatus. I know you guys are sad about that. So sometimes when you work in the hospital, you kind of lose sight of what normal, typical development is. Healthy grandparenting is our solution to keep your finger on the pulse of typical development, right? If you've been around a bunch of 3-year-olds who are sick, you sometimes forget that really what they should be doing is jumping up, running around the room like crazy people, right? And, you know, just doing from one task to the next task to the next task. That's what a typically developing 3-year-old should be doing. In the hospital, a sick 3-year-old sometimes isn't acting like that. Healthy Grandparenting is a program for grandparents who are raising their grandchildren as the primary caregiver. The interns plan activities for the grandchildren once a month at a support group. And it helps them have that reality check of what typical development is, right? And it really provides them with a well-child experience. Plus, it helps out our friend who is a social worker in the School of Nursing with dealing with the kids while he is doing a support group for the grandparents. These kids are going through a lot. Most of them have been taken out of the home for not a great reason. Mom's incarcerated, mom is in rehab, dad's addicted to drugs, they've never met dad. So these kids are going through a lot, right? They're being raised by somebody who is not in even like 2 generations out. So they don't understand the things that they're going through and the issues that they're facing. So it is definitely an at-risk population. Haunted playroom, this makes me sad. Interns are in charge of creating a haunted playroom inside one of the playrooms for Halloween. Typically what we do is we close a playroom on Halloween day. The interns, the day before that, spend the day creating it and transforming it into a haunted playroom. Then on Halloween, the staff go through, and it's kind of a mastery control thing where kids get to scare the grown-ups. Kids get to scare the adults, right? So kids are actually working in the haunted playroom. And the sad news is with COVID, I'm not sure that's going to happen. So we're just going to go right past that one. There's pictures of the haunted playroom. All right, we have camp programs. Oh, this makes me sad too. Be a part of the AU Children's Hospital of Georgia camps, including planning, staff recruitment, coordination, and hopefully sharing care. We'll see, which is a camp that we have for, yeah, tell me about it, for families of newly diagnosed cancer patients. And sadly, that's when COVID all kind of exploded, and we were literally at camp unloading all of the stuff to do camp. And I got a phone call from my boss and said, we are canceling camp. So I had to call all the families, call all the staff. I don't know who was sadder, the families or the staff. But yeah, it was kind of a bad experience as far as that goes. And it was sad. It was the right decision to make. It just was really hard to actually be unloading all of the stuff at the campsite and saying we have to cancel. So what's next? Now, speaking of COVID, I was going to try not to talk much about COVID because I'm sick of hearing about it. So the first thing is to shadow a child life specialist for at least 8 hours. Well, this is the only year, hopefully 2020 is the only year where I'm waiving this. But let me tell you why this is here, right? In the past, I've had an intern show up in August, and she walked through the door and she looked at me. This was many, many moons ago. And she said, I don't like the smell of hospitals. And I was like, well, this is going to be a really long year for you because I can't change the smell of a hospital, right? This is the way it is. So she ended up, and the sad part was that year I could only take 4 interns. I interviewed 23 people for those 4 spots, right? So I told a lot of people that I couldn't take them, and I picked her. And she ended up, after her first day, walking away. So then I had those other people that there's nothing I can do at that point because they've already moved on and decided what they wanted to do and went in. So that's the year that we instituted the Shadow the Child Life Specialist for 8 hours. So you know that this is what you want to do. You can read all day about it. You can take hospitalized child and hear about it. You can read a textbook and say, oh my gosh, this sounds amazing. But until you're actually doing the work, until you actually step into the hospital, until you actually see a kid crying, screaming, bloody murder when they're just having their blood pressure taken, right? Until you have experienced all of that, it doesn't talk about that in the book. So that was why the Shadow the Child Life Specialist for 8 hours was put in there to begin with, because we wanted people who were applying to this program having a good understanding of what child life specialists do, okay? So if you can't do that, which clearly nobody's letting anybody come in and shadow them, I want you to do some soul searching before you apply and just make sure that this is what you are committed to doing, right? This is what your calling is. This is not a stepping stone of, yeah, you maybe want to go to OT school and this might be a good little something just to get a degree in to then apply to OT school. This needs to be your passion, okay? So hopefully and do that however you need to do that. Call a child life specialist, talk to them. What's the best part of your day? What's the worst part of your day? What do you usually do on a day-to-day basis? And all of these girls are going to come up here and tell you there is no day-to-day basis, right? So there's my thing about that, because that's going to be, I'm going to tell you that's going to be interview questions about what is your role? What is your understanding of the role of child life? Right? It's not all unicorns and rainbows, right? It's some hard work. It's some hard work emotionally. And you have to figure out how you can help not only the family and the patient deal with what's going on, but then how you're going to compartmentalize and how you're going to deal with it when you walk out the door. Okay, and not take it home with you and not be a miserable person for the rest of your life, right? You want to be motivated by this work and not drugged down by it, if that makes any sense. And usually when you hang out with a child life specialist for 8 hours, you sometimes learn that it's not all textbook, right? What is written in the textbook is what you would love to happen every day, but that's not sometimes the way it is. You want to get as much experience with kids as you can, both well and sick children. You're going to fill out an application, and then I will be back up here probably in November is usually when our time frame is to interview. Application requirements: you have to have at least 30 hours of classwork. You have to have a cumulative GPA of 3.0, not overall, but a cumulative 3.0. I will tell you that I am a stickler about this, right? If you have a 2.98, that's not really a 3.0, right? The reason why I'm such a stickler is because this is a rigorous program. The bar is way high, right? And these girls can talk to the work requirements. It's not a walk in the park. If you want an easy senior year, this is not the program for you. we have a lot, we demand a lot from our students, and they always come through and do produce what we need them to produce. And that's how I think we have such a successful pass rate on the exam. And also clinically, when they go out into the field, I have directors calling me and saying she was well prepared. She knew what she was doing. She flew through our orientation process. She was amazing. Please call me when you have other graduates who are looking for a job in Texas or Seattle or wherever. I think that that's important, right? A shadow, a child life specialist, I'm waving again. Prefer to have taken or been enrolled in the hospitalized child class. A transcript with 3 letters of recommendation, and 1 has to be from an academic person, right? 1 can be, I would expect that your letters of recommendation are going to be about your work with kids. Like you worked at a camp, you taught dancing, you did, you taught gymnastics for 8 years, you were a nanny for a family with 2 kids that have special needs. Those would be good letters of recommendation, okay? 1 has to be from academics, the world of academics, because I want to hear that you're a good student, that you study, you get your work done on time. All of these things have deadlines, right? And these girls can speak to that as far as assignments. And it's rigorous. There's a lot of stuff to do every single week. It's not, there's not a slack week in there of the 32 weeks that you're with me. So that's really important. Yes.
Would you like an official or an unofficial transcript?
It can be an unofficial because you have to pay for an official, right?
I think you have to pay for it. No.
Okay. Yes, but it needs.
Kym, for those on Zoom, what's the question?
Oh, I'm sorry. The question was, can it be an official or unofficial transcript? And I asked if you had to pay. I don't want you to
You have to pay for official ones, yes.
Right. Yeah, it can be unofficial, but it needs to be sealed so you didn't like change your 10 grades. How's that?
And can I add a quick note about hospitalized child? If you are planning to, if you're planning to apply to this program and you're a junior, you need to have taken or be taking hospitalized child because you won't finish all of your requirements for your degree in time if you don't. So it's not just preferred, you need to be doing it.
Okay. All right. If accepted, get ready for a challenging and fun internship experience. I'm going to save questions because I'm going to bring these girls up and they're going to chat with you.
I can start.
Y'all make sure you introduce yourselves because not everybody knows you.
Okay. Hi, I'm Olivia. Yeah. Well, that made me even shorter. It's fine. Yeah, it's okay. All right. So this internship, really, if you're interested in child life, it's so worth missing your senior year in Athens to be there because it gives you an experience like no other. I think just having twice as many hours and seeing all of the different styles of child life just really lets you kind of form your own style as you see different parts that you like of everyone else's. And the different supervisors are really good about like helping you form your own style and figuring out what works best for you. You go into this internship with thinking that you know what child life is and with your typical textbook definition of like, this is what it is. And you leave with completely different impression of it of like, okay, child life is actually sitting with a patient and talking about how they like to drink Coke with their pizza after they got chemo because that's just normalizing the environment for them. And if that's what they want to talk about, then great. Or after a surgery prep, they run and get their own stuffed animal to show you how to do everything that you just taught them on their own stuffed animal, showing that they understood everything and are more comfortable with it. So it's just experiences like no other. And I just feel like it's a really, yeah. I don't know what else to say. Y'all go.
I mean, we could just do it together.
Okay. Hi, I'm Kayla.
Hi, I'm Jillian.
I can speak a little bit to the weekly work that Kym was talking about. So every single week you do a log, which is a specific prompt that you have to write about. So it can be developmental questions or experience questions. various things throughout the week. And then you also have weekly evaluations where you talk about your highest point of the week, your lowest point, and relate all that to development. You talk about your goals for the week. What else do you talk about?
Yeah. It gives you like a different perspective of what you've done and kind of makes you think through it and like process everything.
Process everything
Yeah.
for sure.
And Kym is really great about giving feedback on every assignment that you do. So she's always encouraging you to think harder or think deeper or think another way about an experience, which is very helpful just in the learning process. Also, I can speak a little bit to the teamwork aspect of this internship. I wouldn't have been able to do it without my other co-interns.
Yes.
You need the moral support. You need
Definitely.
someone to talk with you through an experience you had during your internship, or you know, a bad day, a good day, everything like that. So building relationships with the people you're working with is very important, and making sure to be a team player in that you consider everyone's ideas and not just think your own idea is the best idea.
Right.
So yeah, and also I wanted to say, starting out, I was very nervous because I had no idea. In my mind, I was thinking, how in the world am I going to go into a patient room and even introduce myself? How in the world am I going to go into a patient room and talk them through an IV or stitches? And that's not something that you're thrown into immediately. You're guided through that. So that's something that I wouldn't be nervous about, because you are, you know, you take it step by step and you do mess up and you learn and you get better. And you're not perfect by the end by any means. I don't think anyone can be a perfect child life specialist, but you do get those experiences that you need to be able to be a good child life specialist.
Right. Definitely. I feel like you guys covered most of it. Oh, yes, I could talk about DPGs. So we had this task every week. It was called DPGs, or developmental play groups. And pretty much what we did was schedule out different developmental goals for different age groups. So it'd be like infants, toddlers, preschoolers, school agers, and adolescents. And so we would try to accomplish that developmental goal for the day. And so we would go into different patients' rooms and try to establish that activity, see how well they're doing, see if they met the goal or not. And pretty much we had to take that statistics and see if we like met our goal of, okay, this many children we've seen and this many children have met the goal. And so pretty much it was just kind of our own thing that we got to do. We got to become really creative with the type of activities we got to implement with the patients. So it was definitely both challenging and a really fun thing to be able to establish on our own, for sure.
How was it different than textbook child life
DPGs or in general?
in general?
In general. You can go ahead.
Okay, well, I mean, I don't think in textbooks they really explain what words to use
Right.
during preps or during debriefings or bereavements. They don't tell you what to say. They might tell you the developmental level and maybe some suggestions, but they don't tell you, I mean, even body language and how you act in different situations, or the specific words you use, the specific words you don't use. I think that's all learned through experience and through watching other people and learning yourself through trial and error.
Definitely trial and error.
So what advice would you have for somebody who's thinking about applying but not sure?
Do it.
Honestly, it doesn't hurt to just apply. Whether you're on the line about it or not, it really does not hurt. And I feel like a good indication, and if a good indication is if you get it, you're like, okay, maybe I am kind of prepared to go into this field and be able to do all of this. It just really does not hurt. I would highly recommend applying for sure, especially with Kym addressing how competitive the field is and getting an internship. This program in general is a huge blessing to have, for sure.
And I think even the fact of filling out one application and doing one interview and possibly getting it versus filling out 30 applications, sending it to 30 different places, paying for it to be sent to 30 different places, applying, you know, or getting interviews at 5 different places that are across the country. So it's a lot easier in the process as well.
And on top of that, I know personally, I think y'all felt the same way. When we reached the hours of what a normal internship would be, we had the skill set and we could very easily go get a job, but I personally wasn't comfortable yet to go get a job. And so having that extra time really lets you figure out your style, figure out what works for you, where you like to work, and things like that.
Right,
so.
for sure.
Anything else? I don't think so. Okay.
Okay.
Kym, can you address for everybody when in their college career they should apply? Some people who are on, I know, are not juniors right now.
I think that I mean, you have to have your 30 credits, your 30 courses. So if you don't have your 30 courses, then you're not eligible to apply. So you want to, and we have had people who have maybe needed like a hospitalized child. So they have had their 30 classes, but they needed hospitalized child, and we've interviewed them and then accepted them for the following fall. But those are people that have had all their 30 classes and they're just missing like hospitalized child, for example. So you want to try to apply. I mean, theoretically, it should be done in your junior year to come and be with me in Augusta for your senior year. But sometimes people take a 5th year and that's when that happens. So it really is very individualized. The other thing that I also was going to mention is that we are an accredited internship from the Association of Child Life Professionals. That was a very cumbersome, long process that we had to submit all of our curriculum, all of our assignments, all of our readings, all of that, and it had to fit into the modules that were created by our professional organization. So that gets reviewed, and then they assess whether you can become an accredited internship site or you're not an accredited internship site. So for those of you who are also considering, you know, maybe this isn't the program for you and you're just going to go out and find your own internship, you need to look for an accredited internship. That shows that you're not going to be, internships are very different all around the country. And there are some places, and I can tell you from just going through a round of interviews for a staff position, there are some I had an interview with a candidate who I said, tell me about a procedural support that you did during your internship. And her answer to me was, I did one procedural support during my entire internship. And I did it, wait, it gets better. I did it with a NICU baby. Okay, a NICU baby. This is somebody that is applying for a position that did an internship somewhere in the country that called it a child life internship. She sat down, she applied to this internship. Her one procedural support was with a NICU baby. One of you come up here. I don't care, anyone. Olivia can do it quicker. So how many procedures would you see in a typical night in the ER during your rotation?
Oh goodness, anywhere from like 5 to 20, I would say.
Right. So if she were interviewing for a position today and I said, Olivia, tell me about an intervention that you did for a procedural support, you would have in just one night, right? She has 5 to 10 examples. There's the difference, right? Versus this girl who had one in her entire 12-week internship, and it was with a NICU baby. How many coping distraction things could you do with a NICU baby?
Very little.
Right.
Yeah. Rattles.
So then I ask, was mom there? Like maybe she was preparing mom,
Yeah.
and mom wasn't there. So there's that.
Can you mention maybe some of the procedures that you do get to see?
I can.
Yeah.
Me too.
Do you want to come up and talk
Yeah,
about
y'all
it
can come too. So the question was some procedures we did see. So just alone, like one night in the ER, I had a kid that sliced their hand open from a can, had to get stitches. I had IV things that things. Words are hard. I've done MRI sedations. I have prepped for port access. I have.
So I was thinking too, like stitches, blood draws, allergy testing, sweat testing, buds. I was trying to
buds.
Which is a urinary testing.
Yes.
Urodynamic testing, which is very invasive and very hard for any age group. What else? Foreign object removal. How do you distract a kid who's getting something taken out of their nose?
I've even
Coming
done
for their face.
Yeah, I even did tube removals from the ears, which is like such a quick procedure, but still interesting to see, and you can still help them cope with that. So.
Castings. Traumas. So you're going to take your blood pressure, temperature, maybe even start an IV if you haven't already gotten one. So there's a lot of things that go into that.
Did you guys do grief work?
Yes. Yeah. So I had to do a bereavement for an infant, so like helping the parents through that and doing handprints and footprints for that.
Yes, I had two also. Speaking to the flexibility of working in a hospital as a child life specialist, I got to work on a Saturday morning thinking we were going to the NICU for our normal sibling preps and visits. And there was a death in the ER. So we had to go to the ER because we were the only child life specialists there. So we had to do legacy building, handprints, footprints, talk with the family that was there. And then I had another death. Both of these deaths were unexpected. So in the first one, it was really shocking for everyone because they did not think that it was going to escalate like it did. So again, helping the family through that and expecting the unexpected, I would say, for sure.
And they have sibling resources for when patients pass away too that can help them process through the loss, either with the child life specialist or on their own time. I know mine didn't have siblings. I don't know if yours did. Anything else?
Kym, we have a question from online here. Jessica's asked, is there a set amount of people who get accepted each year, or does it range year by year?
It ranges, and it just really depends on my staffing, and it also depends on the candidates. So what I do is look at the candidates, and then I see they're all scored, and I see where they all fall as far as score-wise, and if there's a natural kind of cut. So it really just depends. We've gone through interviews, and I've selected one. We've gone through interviews and I've selected 6. So it really just depends. I can't see any questions, so
Anybody else on Zoom have questions? You're welcome to unmute yourself, or you're welcome to type them in the chat. I'm not seeing anything so far, Kym.
I don't see any.
I don't either. I'm going to go ahead then and oh, was there a question?
Yes.
How do y'all give a specific example of how CCLS was kind of integrated into an intervention that you plan? All of that. I mean, I think just CPTs as a whole, like we sit down and plan them all together at the beginning, and then like there's certain activities that we plan that report and group socialization, and then like if it was during flu season or whatever, that we put communication together. So multiple of us would go in to provide that group socialization so that we would meet our goals. So we would do things like that, like playroom we did together. There's a lot of group work. And how did you go about normalizing the masks after COVID?
Kym, can you summarize what's going on?
Yeah, I'm sorry. I forget that we have
Yeah,
to talk.
we can't, the mic's not in the classroom.
So
We can't
the
hear.
question was about teamwork and working during DPGs, about trying to come up with, cohesive way to attack kind of the list, right? And then a question was asked about how did you normalize the mask? And their answer was that they did it because they got sent home. So yeah, this group kind of had flexibility is key, a challenging little time. Thankfully, they had a lot of their hours completed. So when we did have to go online and do all this little Zoom craziness, they were towards the bitter end of the internship. And that's when all of COVID really started exploding with masks and all that kind of stuff. And at first, I will tell you that we weren't even allowed in, we as Child Life, because at the beginning of this, I will call it a crisis, we didn't have enough PPE. So what we were doing is just giving stuff, normalization stuff, to the next person who went into the room. The medical center sent home everybody and really truly made it that the attending physician and the primary nurse and the CNA were the only 3 people that were really going into a patient's room. Food trays were delivered on a cart. So, I mean, we've come a long way since then. And now we're using PPE. And now I have staff in N95 masks going into patient rooms. I have staff that are going into the COVID testing site and working with Mr. Potato Head and showing kids how to do the nasal swabs. So we've come a long way. And now everybody's so used to a mask because kids are wearing it at school and, really, HEMONC kids have been wearing it for a very long time. So that's just kind of become, as everyone says, the new normal. It really has. So.
Kym, we had another question come in on chat. On average, how quickly have the interns found a job as a child life specialist once they completed their internship?
Well, for the past 2 years, it's been a little bit skewed because we've done this program where they've come back up here and gone for finished up their graduate degree. But in the past, students have been very successful at finding places, especially if they're not geographically stuck to a region. So you have boyfriend, and boyfriend lives in Savannah, Georgia. So there's one children's hospital in Savannah, Georgia that has Child Life, right? So you're kind of stuck there unless you're going to convince boyfriend to get up and move to Boise, Idaho. If you are geographically mobile, you can find a job, right? And especially you as a new grad coming out with 1,500 hours of experience and a full year or 8 months of clinical experience in all these various areas, you are a very attractive candidate. And you also can answer the question, what procedural support did you do? You have hundreds to pick from versus just one as somebody who just recently hired staff people. So I would say it really depends on you and your personal needs, but you can find there are child life programs out there that have positions. Even now in this time of, lots of programs went through furloughs and cuts and all that kind of stuff. There's still, and because Indeed sends it to me every day, there's still a handful of child life jobs. Not as many as there were, but I also see this as coming back. As soon as we get through this COVID crunch, which, yeah, everybody keeps talking about that and nobody knows when it's going to be, but it's this hypothetical thing of when we get there, they're going to come back, right? So I think that definitely is one thing that, when you're looking at essential versus non-essential employees, we were essential the whole time, right? I haven't been able to clean out a closet at my house yet. So, and I'm thankful for that, right? It's really important work that we do to help kids cope with scary times. And this is really scary when grandma can't come up to visit me, when my dad and my mom and their step people can't come in because I'm only allowed 2 visitors and I'm dealing with a trauma that just happened that 3 family members died. Like, this is hard, and this is really important for child life to be involved in. And we were helpful as a resource to the adult side to all those families who were losing people who were dying from COVID, and giving them resources to share with their family members and the kids and the grandkids and all that kind of stuff, because these were people that were essentially dying by themselves. They had no visitors. So it was helpful for us to step in as a resource and to help out with that. All right, I want to be mindful of the time, and I know it's 1:30 and I know we chatted a lot. Hopefully you found this informative. And I will say that my email address is down at the bottom. So if you have questions that you were too shy to ask, or you don't want to ask, or you didn't ask, there's my email. So please send them. Again, I'm waiving the 8-hour observation. I just hope that you do some research and really understand what child life is and why you're thinking about doing this as your career choice. Because again, there'll be very pointed questions about that during the interview. And since you haven't been somewhere watching somebody in action, I'm really going to ask several questions about that versus just the 1 or 2 that I used to. So anything else, Diane, that I need to cover?
I want to add one more clarifying thing just to make sure everybody is clear. We have had the past few years a joint Double Dogs program. That is not what you are applying to now. This is an undergraduate program. You will finish your coursework, you will go to Augusta, you'll finish there, and you will graduate with your undergraduate degree. I know that there's been lots of confusion floating around, so I want to make sure everybody knew what it is that you'll be applying to. One other little thing, I am going to send Julie Patterson, and I would be happy to send any of you directly if you email me. I just put my email address in the chat. A checklist of what you need to do to apply. Your application is due October 31st, so we're at the middle of September. You've got about 6 weeks to finish up your application if you are applying this year. If you are not applying this year, we will have another meeting like this next year. You're welcome to come. You're welcome to let others know. We will also have a recording of this that you're welcome to go back and watch if you missed something, or to share with other people as well. Thanks, Kym, for coming all the way up from Augusta. We appreciate you being here, and we look forward to hearing from you all who are planning to apply, and we're happy to answer questions.
Thank you so much for doing this.
Thanks very much.
You're welcome.
Yeah.